everyone. This is Dr. Anokhi MD from the Apple Pediatrics. This is the Health Scooter Series live chat with Dr. Richardson on allergies and eczema. Hello, Dr. Richardson. Welcome
Hello,
again.
how are you? Yes, how are you?
I'm good. How are you doing?
Very good, very good.
How's
so
the
we're
weather
at
in
it
Houston?
again.
Yeah. How's the weather in
Well,
Houston?
it cooled off a little bit. We had a big rainstorm and then it cooled off.
Yeah, I know. I was being told it's winter has arrived there. We're still waiting for winter to arrive here. But from a seasonal point of view, it already is, because the temperature is already starting to cool off. So you're seeing a lot of your usual runny noses and coughs.
Yes.
All right. Now, on that note, I think we should just dive straight in.
Okay.
On allergies. So, Dr. Richardson, what are allergies?
Okay, an allergy is basically the body reacting to something that the immune system has viewed as like a foreign attacker. And so the immune system starts charging against it. And when the immune system does that, different chemicals get released that like called histamines and things like, and leukotrienes that actually start making your eyes water, making your throat itch, making your nose run, making you sneeze. And if you have asthma, you can even start wheezing if it goes from the upper airway down to the lower airway. So basically, we're talking about a reaction that the immune system is having to some kind of invading substance like a pollen or a bee sting or something like that, or even a food allergy or something that could cause a reaction in the body. Yes.
Yeah. And in Karachi, we have a lot of dust, so we see a lot of dust mite allergies. And we have a very high rate of pollution.
Okay.
So, I mean, I think that also, I mean, do you agree? I think that also plays some role in
absolutely.
causing havoc.
Yes, when you're talking about ozone and car exhaust and ozone, and these things can be irritants, strong fumes in the air that can be irritants to the airway. Of course, cause your eyes to burn or itch or sting or water, your nose to run, things like that. Itchy throat, all of that. Yes.
So, allergies what are the different types of allergies that people can have? So,
well, you can have what's called environmental allergies. Whatever is triggering your symptoms, they're all in different classes. So you can have environmental allergies, which are things like that basically float in the air, pollen, dust, like you said, dust mites, the little insects that live in the dust. And then you can have environmental odors like strong fumes. That can also be an irritant. Then you can have food allergies where a person may ingest a certain food and that then triggers, again, that response from the body saying, hey, get out of here. And the body kind of goes into attack and tries to get that out. And these are usually like little components or proteins in certain foods. And sometimes you'll find that if the food is fresh or raw, you'll have a problem with it. But if you cook it, which then kind of neutralizes the protein, you won't have a problem. So a person may have allergy to an apple, but if it's cooked in a pie, then they won't have a problem with it. So it's usually like the fresh fruit.
Yeah. So I think it's just important to highlight there that please, if your child, it's only if your physician has said to cook the food and then feed it, you should do that. But if the child has a severe form of allergy to a food product,
avoid it completely.
Avoid it completely. So I have exactly what you're describing as an oral allergy. I can't eat some of these raw fruits because it causes a lot of discomfort in the mouth, sore throats, sometimes a little bit of tummy ache, but it never gets severe. And we know those allergies never do. But when you cook the food, it's completely fine. But it's just important to differentiate because I don't want parents to go start cooking foods that their child is allergic to.
That's only true about fruits. Now, if we're talking about tree nuts, peanuts, and things like that, whatever form they're in, there are some people who can't even be in an area where they're even being handled because that's enough to get them sick. So they're definitely, if you have a food allergy, the key protection is avoidance. And then you can have allergies to medications. The most famous one people know about is penicillin. but some people can have allergy to sulfa medications and other medications. You can have allergies to medications. You can have eczema, which is like where your skin is super sensitive to things that come in contact with it. And then you can also have a skin contact type of allergy. And that's where, you know, like different metals like coins or jewelry, different soaps or anything that can touch the skin and then irritate the skin, that can be a problem. A real important one is latex allergy, which is important when you're talking about baby nipples, pacifiers, things of that nature. If your baby is allergic to latex, that can sometimes be very serious. It's very important they label the charts in the hospital because that's a very serious allergy, latex allergy. So,
so what do the kids, I mean, what do the kids, because this is one of the questions parents are going to ask, because you're highlighting latex allergy. So if a child is on a bottle that has latex in it, I mean, what do you see?
I mean, you may see where their lips get swollen when they're using the bottle. Sometimes babies that are using pacifiers, and where the two areas where the pacifier touch their cheeks, that area will become very red and irritated. So, and then of course, if you put a Band-Aid on the child and that has latex and to latex, that you would see where the Band-Aid is, that area would get red and swollen. So if there's any question that there's and as a matter of fact, you can even see some products even have latex free on them. So any plastic looking product, if you think that your child has a problem with that, you want to make sure that it's actually labeled that it's latex free to avoid that.
Yeah. Okay. All right. So we've gone the different, we got the environmental allergens, we got the contact allergens, and we got the food allergens. Okay.
And medication, yeah.
Medication allergens, yeah.
Oh, and another one is bee stings and insect venom. Bee stings can be very serious, and if you have a problem with that, you know, you would need to have that EpiPen, the one that works quickly, those self-auto injectors. You need to have that. Anybody that has serious food allergies to bee stings, and these are usually identified once you have had a consultation with an allergist, or if you have one episode, you definitely want to get with an allergist so that you can protect yourself in the future.
So we don't have pediatric allergists as such in Pakistan, Karachi. So the patients usually come to me, and obviously I ask you for advice if I get stuck anywhere. But yeah, another important thing to highlight about allergies. So if the patient has been exposed to it once, I mean, like for example, with food, when we tell our parents, when we're starting on solids, we tell them to highlight. Went off the phone.
Three times a day, so or 3 to 5 days in a row. That way they can know if the child had some kind of reaction. If the child has some kind of reaction to the food, you will know because you're giving you test each food individually. 3 times a day for 3 to 5 days in a row. That way you'll know.
No, yeah, exactly. And it's I think it's important to highlight that it may not be on the first exposure, because then I'll have parents start adding everything in, and I'm like, no, you need to do one thing at a time so that you can identify easily. And it may not be the first exposure. The first exposure, the body first recognizing that, oops, I don't like this. And the subsequent times is when
you get the actual reaction. Exactly.
Yeah. So if, for example, a child has eaten something this morning and tomorrow morning they start throwing up, would that be an allergy to what they ate this morning?
Not necessarily, because usually it's within a couple of 30 minutes to about 30 minutes, no later than about 4 hours, because you usually have that quick reaction to that. So you would know immediately. You would.
Yeah. So that's also something that I thought was important to highlight, because you get a lot of parents who come in, they're like, but I thought yesterday afternoon they ate something and they're vomiting now. And I'm like, no, it's usually within 2 hours you see profuse vomiting, diarrhea, or a skin rash. And as you said, mostly within 30 minutes. So we've done food allergies. Environmental, the allergies that causes your runny nose and watery eyes and things like that. So tricky question.
Mm-hmm.
It's winter. So you're going to see a lot of runny noses and watery eyes and sore throats. Does that necessarily mean that we have so many kids who are coming down with allergies in winter?
Well, no. Usually, it's the key with allergy. A lot of times is itching. You'll have an itchy throat, itchy eyes, or your nose is itching. If you have a cold, your nose will be running, but you won't have itching. Your eyes won't be itching. The key with allergy is that there's itching because there's irritation. So if they're just having a runny nose, that's not allergy. In the wintertime, children can get exposed to viruses. You can have 7 to 9 colds in a season, and it usually takes you about 7 days for the cold to run its course. So if you pick up one virus and then a week or so later you pick up another virus, it can look like every time you turn around the child's nose is running. But you simply just want to rinse the nasal passages, just kind of make sure your children are washing their hands, because hand sanitizer doesn't get rid of all the germs. You really need to wash your hands. I always tell them, sing the happy birthday song. That's how you can easily know 20 seconds. You want to wash your hands, rub them together, and then rinse them for 10 seconds. And that way you can be sure that you're getting any germs off of your hand to pass it, because everybody inadvertently touches their face, touches their nose, and that's an easy way to spread germs from one person to the other.
So as you said, important to highlight in the winter months, your child, especially the younger ones, it's normal for them. I'll just say in Urdu for the Urdu speaking my Urdu speaking patients. सर्दियों के महीने में ये कोई जब बच्चे को नाक बह रहा है, आंखें लाल हो रहे, खांसी हो रहा है, इसका मतलब नहीं है कि विंटर के मंथ में सर्दियों में एलर्जीज हो रहे हैं. सर्दियों के महीने में छोटे बच्चे को ये नज़ला जुकाम हो सकता है 2 दफ़ा महीने में, पूरी सर्दियों में हर महीना दो दफ़ा नाक बह रही है, जुकाम, नज़ला, ये बहुत नॉर्मल होती है और इसका मतलब नहीं है कि बच्चे को एलर्जी हो रही है. And another thing important I think to highlight is, do antihistamines or any of the allergy medications that we're going to talk about right now have an effect on your viral colds and coughs?
Well, no, they don't have an effect on that, because what's driving the antihistamine, what it's combating, is the release of histamine. When you have a runny nose from a cold, there's no release of histamine, so there's nothing for the antihistamine to work on. So basically, you just want to kind of keep the nose moist. You wipe it, use Kleenex and use once and discard. That way, you don't like using a handkerchief. You could end up reinfecting yourself.
So मैंने अभी पूछा था कि जब बच्चे को नज़ला जुकाम होते हैं, दवाई देने से कोई फ़र्क पड़ता है, स्पेशली वो दवाई जो एंटीहिस्टामिन कहलाते हैं, तो कोई फ़र्क नहीं पड़ता है. आपको बस नाक को वो एक बोतल आती है नॉर्मल सेलाइन की, नॉरसेलाइन या ऐसे कुछ, बस नाक को साफ करनी होती है, देखना कि बच्चे अच्छी तरीके से पानी और दूध पी रहा है, अच्छी तरीके से खा रहा है, और हाथ धोना है. हाथ धोना बहुत ज़रूरी है. Okay, all right, so we've touched on medication. So what are the medications for allergies?
Okay, well, there's several classes of medications that are used for allergy, and they're all targeted at either eliminating the symptom or trying to control the symptom. So the antihistamines are kind of like the first line, because a histamine is a very powerful chemical in the body that keeps the allergic response going. So if you can take medication to kind of taper that down, that really helps. You want to use the antihistamines that are non-sedating. That's kind of the ones that won't make you sleepy and drowsy. Especially if the child is in school, you don't want the child sleeping in school because they're taking medication that's making them drowsy. Now, sometimes the antihistamines may not be enough. No.
Do you have the generic names of the antihistamines?
Yeah, well, we're talking about either loratadine or the cetirizine. Yeah, those are the ones that are very common over the counter. You don't even need a prescription for them, and they are very helpful in terms of eliminating your discomfort and itching that you have with allergy. They also, a lot of times, if you have a lot of problem with a lot of nasal congestion, where the lining of the nose is very swollen, and the child is just having a lot of problems with that, using an inhaled steroid, whether you spray the little mist into the nose with the steroid that really helps shrink swelling in the nasal passage. And it also kind of stabilizes. There's a cell in the body, the mast cell, that gets disrupted and releases the histamine. So if you can kind of stabilize that to not release histamine, that really helps also. And then there's a third line of medications. They call them leukotriene modifiers. Leukotriene is another chemical in the body that once it gets activated can really keep the allergy symptoms going. So if you can take a medication that kind of tapers the reaction of that chemical down, that helps. Leukotriene modifiers, and those that you need a prescription for that.
Yeah. So can I just translate this into Urdu?
Yes.
So डॉक्टर रिचर्डसन हमारे साथ अभी बात कर रही थी, वो जो आपके जो बच्चे की एलर्जीज होती है जहाँ पर नाक हर वक्त बहरा होता है या बहुत ब्लॉक्ड होती है, बहुत सारी इचिंग होती है, आपको ये ख्याल रखना है कि फ़र्क कैसे जानते हैं कि अगर ये एलर्जी है या सिर्फ नज़ला ज़ुकाम है। एलर्जी में बहुत सारी इचिंग होती है, तो नाक को हर वक्त ऐसे स्क्रैचिंग करते हैं बच्चे को, और ये नज़ला ज़ुकाम में नहीं करते हैं। और अगर बच्चे का बहुत कंजेस्शन होती है नाक में, तो 3 दवाएं होती है जिस पर दूसरी लेवल्स पर करते हैं। ये आप डॉक्टर के साथ ही बात करके देते हैं, खुद ही नहीं देते। पहली वाली होती है एंटीहिस्टामिन्स। हिस्टामिन्स वो सब्सटेंस है जो जिस्म में होती है, जो रिलीज होती है एलर्जीज में, ठीक है। और ये चीज़ होती है जो सारी जो इचिंग होती है, मेरे ख्याल से खारिश बोलते हैं, वो कराता है। तो जब हम एंटीहिस्टामिन्स देती है, इसको थोड़ा सा आराम मिलता है, ठीक है। अगर एंटीहिस्टामिन्स देने के बाद हम चंद दिनों के लिए देते हैं एंटीहिस्टामिन्स, अगर हम देखते हैं इससे के साथ काम नहीं हो रहा है, तो दूसरा लेवल जो होती है वो नेजल स्टेरॉइड्स होती है, वो स्प्रे होती है। एंटीहिस्टामिन्स हम लेते हैं सिरप के फॉर्म में या दवाई के फॉर्म में, वरना स्प्रे लेते हैं स्टेरॉइड की, ठीक है। ये भी बहुत सेफ होती है, और आम तौर पर मेरे एक्सपीरियंस में जो बच्चे एंटीहिस्टामिन्स पर रिएक्ट नहीं किए, वो स्टेरॉइड्स पर बहुत अच्छे तरीके से रिएक्ट किया था कर जाते हैं, और वो बहुत अच्छे तरीके से सेटल हो जाते हैं। और अगर एंटीहिस्टामिन और नेजल स्टेरॉइड्स के बावजूद ये सेटल नहीं हो रहा है, तो तीसरी लाइन जो होती है वो ल्यूकोट्राइन रिसेप्टर इनहिबिटर्स होती है, मोंटेलुकास्ट होती है, जो हम देते हैं। दिस इज द जेनेरिक फॉर्म, ठीक है। जेनेरिक का मतलब है, अगर आप बॉक्से पर देखेंगे ना, तो उसके नीचे लिखा हुआ होगा कि इस दवाई के अंदर कौन सी दवाई होती है, ठीक है। तो ये है 3 दवाइयों, एक के बाद दूसरे देते हैं, सारे 3 एक साथ पहली दफा नहीं देते। हमें देखना होता है कि अगर पहला वाला देते, देखना होता है कि अगर ये काम कर रहा है तो पर उसी पर पहली लेवल पर रहती है, अगर काम नहीं कर रहा है तो दूसरी स्टेप पर जाते हैं, अगर वो भी काम नहीं कर रहा है तो तीसरी स्टेप पर जाती है। मगर ये सारी चीजें जो होती है ना, आप अपने डॉक्टर के साथ बात करके करना होता है। ये प्लीज आप खुद घर पर नहीं करें। Okay, I just highlight, I know it sounds a little bit more than what you said, but I was also highlighting that they shouldn't just go and start these things on their own without actually speaking to their physicians, because
exactly.
every medication is available without prescription,
Oh,
unfortunately.
okay. All right. Even the leukotrienes?
Yes.
Wow, that's
You can just walk in there and get it.
Wow, okay.
So antibiotics, everything is available without prescription.
Wow.
So unfortunately, there is a possibility to get it. So it's very important that we highlight that you really need to speak to your physician, your pediatrician. Come into us to the Apple Tree, or go to your pediatrician and speak to them. But this is just to inform you, like basically to educate what we're doing.
What's being done, yes.
Yeah, so this is what we call rhinitis, your allergic rhinitis, what we were talking about. So the next, but it's pretty much the same category for all allergies, more or less.
Yeah.
It's in different forms, the medications. Am I correct?
Yes, that's
more
true.
or less, yeah. So yeah, so the next, in eczema medication.
Okay. Now, eczema, you have 2 parts with eczema, because you really want to keep, the key with eczema is to keep the skin moisturized.
So shall we just touch on like what eczema is? Because I don't think
eczema is a hypersensitivity of the skin, where the skin reacts to different substances that can come in contact with it, and or sometimes the child may eat something that causes the skin to flare. But when you have a flare, that's when you want to do treatment. So if you know something that kind of causes the child's skin to flare, the key is to try to avoid that. And then if the child does have eczema, you can do, the key is to keep the skin moisturized so that whatever topical treatment that you use will be able to get to the skin and help control the symptoms. Eczema is usually treated with steroid creams. You want to start with the lowest strength first because you don't want to overdo and use powerful steroids because steroids can make the skin thin. So if the skin is very thin, it's more easy to be irritated, breakthrough, and then you're at risk also for getting a secondary skin infection, and you want to definitely prevent that. But the key, excuse me, is to use, excuse me, I'm sorry, is to use a non-soap body wash because soaps can be too harsh for the skin. Even mild soaps can be too harsh for your skin if you have eczema.
Yeah, so that's what I usually recommend to my patients when they come in. So eczema में आप क्या देखते हैं कि जो आपके जिस्म बच्चे के जिस्म पर होती है ना, बहुत ड्राई हो जाती है, कभी कभार फ्लेकिंग होती है, पीलिंग होती है, स्किन बहुत मोटा पड़ता है, आमतौर पर जॉइंट्स पर आती है.
Yes, yes.
Concentration होती है ना joints पर. See, you're understanding even without me translating. Very good. तो ये यहाँ पर ज़्यादा तौर पर प्रॉब्लम्स होती है, मगर पूरी जिस्म पे भी हो सकती है. तो पहली काम करना होता है आपको कि अवॉइडेंस होती है. तो आपको देखना है कि एक्सपोजर क्या है. So I'm just explaining that we need to first avoid any of the allergens.
Yes.
और फिर उसके बाद जैसे डॉक्टर रिचर्डसन ने बोला है कि जब जिस चीज़ से आप बच्चे को नहाते हैं उसमें साबुन नहीं होना चाहिए. तो आपको बोतल पर देखना होता है साबुन के बगैर वाली जो वॉशेस होते हैं ना, वो इस्तेमाल करना चाहिए, सोप फ्री वॉशेस. और जब बच्चे को नहाते हैं ना, तो बच्चे इतने गंदे लगते हैं, गंदे पर इतने गंदे नहीं होते, उनको आराम से धोते हैं. डोंट स्क्रब द किड्स, डोंट लीव देम अंडर द शावर फॉर टू लॉन्ग. ये सारी चीजें स्किन को एग्रेवेट करती हैं. और उसके बाद अच्छी तरीके से मॉइस्चराइज करना चाहिए. I mean, you mentioned about moisturizing at night.
Yes, the thing is, you want to, especially when right before the child goes to bed, they're wearing their pajamas. So you want to put some moisturizing lotion on their skin, and then they put on their pajamas, and then they're under the cover. So that kind of seals in the moisture and helps keep the skin healthy and keeps the skin protected. If the skin, see what happens they always explain about the itch scratch cycle.
Yeah.
The more you scratch, the more you itch, the more irritated your skin comes. And so you get in an itch scratch cycle. But if you're moisturizing your skin, it won't be dry, it won't be itchy. And it is, you usually see eczema especially in young infants, it'll be on the face, and it'll either be where the joints are, either in the front or the back of the joints, like behind the knee, by the wrist, in the little fold of the skin where the elbow is, around the neck especially. And sometimes these areas get moist because the skin is folded on each other. You can get like a secondary yeast infection in there. So you have to be very careful. If that happens, you can just see the doctor and get treatment for that.
Yeah. तो डॉक्टर रिचर्डसन क्या बता रही थी, एक ट्रिक बता रही थी कि जब आप बच्चे को नहाते और मॉइस्चराइज करते हैं ना, या आपको शाम को करना चाहिए जिस बच्चे को एक्जिमा या एटोपिक डर्मेटाइटिस होती है, क्योंकि जब आप नहाते हैं वो साबुन के बगैर वाले जो वॉशेस के साथ नहाना चाहिए. और फिर उनको अच्छी तरीके से क्रीम करना चाहिए, वो हाइपोएलर्जिक क्रीम के साथ. क्रीम में कोई खुशबू नहीं होना चाहिए. और फिर जब वो कपड़े पहनते हैं और बिस्तर के अंदर जाते हैं ना, तो सारी चीज़ें सील्ड इन हो जाती है, जिस्म पर रहता है, तो रात में ज़्यादा बेहतर होती है. तो अगर दवाई की ज़रूरत होती है, दवाई लगाने की, स्टेरॉइड लगाने की, तो वो ज़्यादा बेहतर तरीके से अब्जॉर्ब हो जाती है. आपका जो टारगेट है बच्चे का स्किन को अच्छी तरीके से नरम रखने के लिए, तो जितनी दफ़ा आपको मॉइस्चराइज करना होता है, आपको करना होता है. So I'm just saying that the target of this our treatment is to keep the skin nice, soft, moisturize if you need to. Because often I'll have parents who come in, they've just moisturized once in the morning, and they've come in the afternoon, they're like, my skin's so dry, the child's skin's dry. I was like, well, you are allowed to put in another layer of moisturizer. That's okay. I mean, you agree with that? Yeah.
Yes, I do. I think it's important, especially if they're younger children, you definitely want to keep their skin moisturized, because when they're going to sleep, especially, that's when the children tend to really scratch and dig into their skin. And the more you scratch the skin, the more you traumatize it, the more you itch. So, and again, you don't want to get in that itch scratch cycle. That's when it's really bad.
तो डॉक्टर विशेषण बोल रही है कि आपकी जो टारगेट होनी चाहिए कि बच्चे को अपना तो जिससे मैं इसको स्क्रैच नहीं करना चाहिए, खारिश नहीं होना चाहिए। तो अगर आप मॉइस्चराइज करेंगे तो वो इतना ज्यादा स्क्रैच नहीं करेंगे। जब भी बच्चा एक दफा स्क्रैच करता है तो जिस्म के जो नीचे ना स्किन के नीचे एक सेल्स होती है जिसमें हिस्टामिन होती है, वो रिलीज होती है, तो खारिश ज्यादा हो जाती है, इचिंग ज्यादा हो जाती है, और फिर उसको फिर से स्क्रैच करना, दिस इज कॉल्ड ये कहलाती है इच स्क्रैच साइकिल। तो आपको इसको इंटरप्ट करना चाहिए, इसको बंद करना चाहिए। तो इसको करने के लिए आपको बच्चे को अच्छी तरीके से मॉइस्चराइज करना चाहिए। आपका टारगेट है कि स्किन को अच्छी तरीके से सॉफ्ट और सपल रखना है ताकि आपको स्टेरॉइड्स की जरूरत नहीं हो। एंड स्टेरॉइड्स अगर आपने स्किन को अच्छी तरीके से, आई मीन यू वर सेइंग that it won't absorb before when we were chatting.
Right. If the skin is thickened because it's trying to protect itself from all that scratching, then the medicine cannot get into the skin to heal the skin. So you want to keep the skin moisturized so that it can receive the medication, the steroid treatment that will go and get and heal the skin. Yeah.
हाँ, तो डॉक्टर रिचर्डसन बोल रही है कि अगर आप जिस्म को अच्छी तरीके से नरम नहीं रखेंगे तो अगर हम स्टेरॉइड इस्तेमाल, दवाई वाली क्रीम इस्तेमाल करेंगे, वो जिस्म के अंदर नहीं जाती है। तो आपको पहली लाइन है सोप फ्री वॉशेस, अच्छी तरीके से बच्चे को मॉइस्चराइजर इस्तेमाल करें, हाइपोअलर्जिक मॉइस्चराइजर जिस पर कोई खुशबू नहीं होती। I'm saying it's supposed to be non-perfumed because you got lots of perfume.
Oh yes, yeah. You don't want any.
We love smelling our babies and we love having our babies smell like nice.
Yeah.
So like no, they should smell like babies. They shouldn't smell like perfume. हाँ, अगर आप ये नहीं करेंगे तो दवाई अगर जो खाल है ना अगर बहुत ड्राई और थिक हो जाती है तो दवाई अंदर नहीं जाता है, और यहाँ पर इन्फेक्शन की बहुत रिस्क होती है। और अगर आप देख रहे हैं कि लाल हो रहा है, गीली हो रही है, तो आपको फौरन आकर दिखाना होता है ताकि हम देख सकते हैं कि अगर उसके ऊपर दूसरी वाली दवाई लगाना चाहिए। आमतौर पर फंगल इन्फेक्शन हो जाती है, डॉक्टर रिचर्डसन बोल रही है, तो आमतौर पर हम कभी कभार वो एंटी फंगल्स भी डालते हैं। Okay, so I just explained that often in these areas it can be fungal infection, so we need on top of all these other medications, your moisturizer, your steroid, we also need to add in an antifungal in there. And I think it's important to highlight that which I've done, that without doing all of this stuff, there's no point in giving the steroid, because I have a lot of parents who come in, they won't moisturize, or they will do it in the morning, but in the evening it's all dry and itchy, and they're like, oh, I'm just going to put some steroid cream on it. And I'm like, no, your child's skin, I can see it's dry. If I can see it's dry, if I can feel it's dry, you need to cream the child in without aggressively doing these treatments. It's why are we going on to the next level of adding in steroids to that?
Right.
And I think it's important to highlight.
It's just that the steroids will work better if the skin is soft and moisturized, because it can then receive the treatment. That's the key.
Exactly.
That's the key.
Exactly. And then I think it's just important to highlight with all allergies, avoidance is key.
Yes, avoidance is the key. I mean, if you happen to have made a relation and said, oh, every time my child does this, their allergy symptoms get really bad, then that's something that you want to avoid, especially if it's something that you can easily avoid. If it's some air freshener that you purchase from the store and every time you spray it, you notice that your child just sneezes and gets all congested, then don't use that particular air spray or freshener. You have to be very careful. They have some of those air fresheners that kind of release every 30 minutes or something like that. That's creating your own indoor air pollution. You don't want to do that. Yeah.
तो डॉक्टर रिचर्डसन ने हमने अभी बात किया है, और उन्होंने बताया है कि अगर आपके बच्चे को एलर्जी हो, जो भी किस्म की एलर्जी हो, आपको देखना है, इन्वेस्टिगेट डिटेक्टिव बनकर देखना है कि ये कौन सी चीज कर रही है। तो फॉर एग्जांपल अगर बच्चे ने कोई जो खुशबूदार जो चीज होती है, जब भी ये एक्सपोजर होती है ना, तो फिर बच्चे की एलर्जी, जो भी एलर्जी है, बहरी हुई नाक या एक्जिमा फ्लेयर अप हो जाती है ज़्यादा ख़राब हो जाती है। तो इस तरह की तरीके से आप देख सकते हैं कि हाँ इस वजह से एलर्जी होती है। तो पहली चीज़ होती है एलर्जी में, आपको इन चीज़ों से दूर रहना चाहिए। अगर आपने देखा है कि ये कुछ चीज़ है जो मेरे बच्चे की जो जिस्म है इसको ख़राब करती है, या इसके नाक की बहुत कंजेस्शन हो जाती है जब बच्चे की इस चीज़ों के साथ कांटेक्ट होती है, तो पहली चीज़ होती है उसकी अवॉइडेंस, ताकि एलर्जी नहीं हो। और फिर अवॉइडेंस के बाद अगर फिर भी हो रही है थोड़ी बहुत, तो फिर ट्रीटमेंट आती है फर्स्ट लाइन ट्रीटमेंट। आपको थर्ड फोर्थ लाइन ट्रीटमेंट पे जंप नहीं करनी चाहिए, फर्स्ट लाइन ट्रीटमेंट। और अगर फर्स्ट लाइन ट्रीटमेंट काम नहीं करे तो फिर डॉक्टर के साथ बात कर सेकंड लाइन ट्रीटमेंट पे जाते हैं। I just highlighted, like you said, about the allergens, avoiding allergens, playing detective, and then always start with the first line treatment. Don't jump to the third or fourth line treatment.
Right.
Which a lot of parents everywhere, all of us, we just want to instantly cure our kids, but it is still a stepwise process that we have to do.
Exactly.
So we've done nasal allergens, we've done eczema.
Yes.
We've done food allergens.
Yes.
Again, with food allergens, if a child does react, what do we do?
Okay, with food allergies, you want to be really vigilant about keeping the child away from those, because that a lot of times food allergies are not just a little local reaction. Like if you know, you get a little irritation, your eyes might itch a little bit, your nose run a little bit, but that's not life threatening. Food allergies sometimes can be life threatening. If you get too much, if you get exposure to the allergen and then you have a reaction, we're talking about where your blood pressure drops, where your throat starts swelling up, where you're having difficulty breathing. So food allergies can be very, very serious, especially people that have allergies to like peanuts or wheat or tomatoes or eggs, soy. Some children, you know, they may even vomit. They may have diarrhea, severe stomach cramps. And then it can even go, it's rare, but you know, for if somebody gets into like peanuts or something like that, that they're allergic to and they have a very extreme reaction, they go into anaphylaxis. That is like life threatening. So people that have food allergies, especially if they've had, and you can have one allergic reaction and it's not so severe, but then the next one or the third one might be very severe. And these are people that, you know, should probably they should carry what they call the auto injector, that then has the special medication in it called epinephrine that can immediately get into the bloodstream and stop the allergic reaction, so that, you know, to actually save your life. Yeah.
Okay. Umar, I can't read the rest of your comment. It says, thanks a lot. I am a mother of 2, but I can't read what's after that. If you can just write it again. It's not letting me open it on my page. Just write after what you've written after mother of 2, what you've written there, because I can't read. I'll just translate this in Urdu. तो जो डॉक्टर रिचर्डसन ने बोला है कि खाने के वक्त जो एलर्जीज होते हैं ना, कभी कभार पहली दफ़ा नहीं होते मगर दूसरी दफ़ा होते हैं जब एक्सपोजर होती है। और जितने भी दफ़ा बच्चे को एक्सपोज करते हैं ना, उतने ही ज़्यादा रिएक्शन हो जा सकती है। और जो फूड एलर्जीज होती है वो ये सिर्फ नहीं है कि बस रैश हो जाती है, कंजेशन हो जाती है, ये बहुत सीरियस भी हो जा सकता है। जो सारी जो सांस की जो जगह है ना, वो पूरी चीज़ें फूल जाती है, स्वेल हो जाती है और बंद भी हो सकता है, और बच्चे की सांस लेने में मुश्किल भी हो जाती है। इसका ये हम बोलते हैं एनाफिलैक्सिस। और इसके लिए जो बच्चे बहुत सीवियर फूड एलर्जीज के साथ होते हैं ना, इसके लिए एक दवाई होती है एपिपेन। एक लिटरली ऐसी इसी तरीके से लगता है, दिखता है, इट्स एन एपिपेन। और जब उन बच्चों में बहुत सीवियर एलर्जीज होते हैं, ये एपिपेन बच्चों को पास रहना चाहिए जहाँ पर भी बच्चा जा रहा है। और अगर एक्सपोजर होता है, जैसे हमने पहले बोला था कि चंद लोगों को खाना भी नहीं होता है, अगर वो कमरे में है, जैसे नट एलर्जीज होते हैं, चंद बच्चों में जो नट एलर्जीज होते हैं, अगर कमरे में भी आ जाते हैं जहाँ पर नट्स है ना, उनकी एलर्जिक रिएक्शन होती है। और अगर हमें पता है कि बच्चे की बहुत सीवियर रिएक्शन हो सकता है, तो हम एपिपेन लेकर दे देते हैं। ये फौरन sort of react करता है to try वो allergy को reaction को कम करने के लिए. मगर I mean, I think it's important also to highlight that don't just assume that you take your EpiPen, you're safe everywhere you go, because there are cases out there where they've had a severe reaction, they've had their EpiPen, and it still turned out really badly.
Well, yeah, because sometimes you may have to get a second dose. And I always tell people, I said, whenever you have to use your EpiPen, immediately call emergency response. I don't know what the number is there. Here is 911. So if you, I put that on all of my prescriptions. If used, immediately call 911, because you never know, it may, the medicine will wear off in about 20 minutes and the allergic reaction may come roaring back, and you'll need to have a second dose or, you know, rescue medicine available immediately.
Yeah, unfortunately, I mean, there was an incident recently where the food was not labeled. This child had a nut allergy, pine nut allergy, and it was not labeled on the sandwich that they were, I think it was pine nuts in it. And it was on a flight. And they had their EpiPen, but it wasn't enough because they didn't have a second one around. So unfortunately turned out really badly for that child. तो हम जो बोल रहे हैं ना, जो डॉक्टर रिचर्डसन ने बोला है कि बताया है कि अवॉइडेंस का मतलब इन चीज़ों से दूर रहना बहुत बहुत ज़रूरी है, स्पेशली जब बहुत सीवियर रिएक्शन होती है, क्योंकि कभी कभार जो होता है कि सिर्फ एक ही दफ़ा एपिपेन लगाने से काफ़ी काम नहीं होता है, क्योंकि 20 मिनट के बाद फिर से रिएक्शन हो सकता है. तो जब भी आपको एपिपेन लगाना है तो आपको फौरन अस्पताल जाना चाहिए. और पाकिस्तान में मुझे पता है एम्बुलेंस सर्विस इतनी अच्छी नहीं होती है, मगर अमन फाउंडेशन होती है, दूसरी भी एम्बुलेंस सर्विसेज होती है. अमन फाउंडेशन का नंबर है 1021 और मेरे ख्याल से ईदी की 115 है या 155. आपको प्लीज़ देखना चाहिए अपने लोकल एरिया में कि एम्बुलेंस के नंबर क्या है और अपनी फ्रिज पर लगाने चाहिए, क्योंकि एडवांटेज एम्बुलेंस की ये है, कभी कभार एम्बुलेंस में दवाई होती है, आमतौर पर नहीं होती है, मगर एडवांटेज जो होती है ना, एम्बुलेंस में ऑक्सीजन होती है. और एम्बुलेंस जब आप जाते हैं ना अस्पताल, मैंने देखा है लोग जगह बनाते हैं तो आप ज्यादा जल्दी अस्पताल पहुंच जाते हैं, मगर अगर आप अपने गाड़ी में जाएंगे ना, लोग जगह नहीं बनाते. So I was just highlighting that yes, to keep a number of your local ambulance service on the fridge, know that you're supposed to use it. And I know in Pakistan it's we have a good ambulance service called the private ambulance service called Aman Foundation that I've given that number. But also I've highlighted the importance why we use the ambulance service, because they get you to the hospital faster, because people actually do make way for an ambulance. They won't make way for your car necessarily. Okay, so that's what, and majority of the ambulances do have oxygen.
Oh wow! Yeah, and that's very important, especially if you're struggling to breathe. You definitely would need oxygen. Plus, the people that are on the ambulance, they're usually paramedics or somebody that has some medical training that could actually help also.
Unfortunately, here, no.
No.
No. They have a little bit of. I think they have a little bit of training, except for the private ambulance service, which was the Aman Foundation. They've done a really good job. So they do have EMT training. But the general ambulance services, they basically just pick and transfer, and they have oxygen. That's pretty much it. It's grab and run. So, but I think it's for city of Karachi, it's a big deal that we have quite a few ambulance services, and they're quite good. They're spotted all over the place. Unfortunately, no, it's not like in the US where it's fully kitted and fully trained staff. But except for the private one, they do have medications. Whether they have EpiPens or not, I do not know. But I have used them in the past, and they've done quite a good job. But I've never needed them to give, and I'm not asked whether they have EpiPen. But it's something to ask. Okay, so we've done avoidance is key. Cure for allergies. That's one of the questions everybody keeps asking me. Is there a cure?
No, there's no cure for allergy, because it's basically how your immune system is kind of wired. An allergy has several components. It can be like it can be a genetic component, whereas if at least one of your parents has allergies, there's an increased possibility that the child will have allergies. And it's also shown that, especially in terms of atopic dermatitis, as many as 60% of infants, by the time they're 12 months old, will already have some symptoms of eczema. And it rises to 90% by the time you're 5 years old. So if you're, and the thing with allergies is that it comes and goes. So, so when the flare is over with, you may think, oh, it's been cured. And then they get another flare and you think the medicine failed. The medicine did not fail. This is a chronic condition that comes and goes. It comes, they hangs around for a little while. You put some medication on it, you get everything calmed down, and then everything is fine, and then it flares back up again. That's why they call them flares, because everything is fine and then it starts over again. So it's a condition that comes and goes, and so there's no cure. It does clear up and come back, but when it clears up, it's not a cure. And when it comes back, don't feel that the medication didn't work. You just have to use the medication again for the next episode. Yeah.
तो मैंने अभी पूछा है कि एलर्जीज की कोई क्योर होती है या नहीं, कोई परमानेंट सोल्यूशन जहाँ पर ये फिर से कभी वापस नहीं आए, ये नहीं है, ये ऐसी चीज़ नहीं होती, क्योंकि जो एलर्जीज होती है ज़्यादा तौर पर जेनेटिक होती है। इसके मतलब है कि खून में बैठा हुआ है, ख़ानदान में बैठा हुआ है, और ये इसको निकालने की कोई हमारे पास तरीका नहीं है। जब किसी को एलर्जी हो, ट्रीटमेंट करवाते हैं टू रिलीव, इसको हम बोलते हैं, इसको आराम दिलाने के लिए हम दवाई देते हैं। आराम आ जाता है और फिर हम सोचते हैं कि अभी कोई रिएक्शन नहीं हो रहा है, तो मेरे ख्याल से हमने ट्रीट किया है, क्योर किया है, अब सब कुछ चला गया है। ये ऐसा बात नहीं है। इसका मतलब है ये जो सारी चीज़ें सेटल हो जा सकती, मगर फिर से हर वक्त जब भी एक्सपोजर होती है, एलर्जन में कांटेक्ट आती है ना, जिसी चीज़ें से कांटेक्ट आती है जिससे ये रिएक्शन होती है ना, जब हम ऐसे इस तरीके से इन चीज़ों से कांटेक्ट हो जाता है फिर से, तो फिर से फ्लेयर अप हो जा सकती है, जिससे हम फिर से लाल और ड्राई हो जा सकती है, नाक फिर से कंजेस्ट हो जा सकती है। तो इसकी कोई क्योर नहीं है। ये अगर आपके पास एलर्जी है तो ये जिंदगी भर ही होती है, तो अनफॉर्चुनेटली हमारे पास कोई क्योर नहीं है इसके लिए। ओके, all right.
Did you want to talk about there are some treatments for eczema, because some children have a lot of their skin right around the eyes may be involved, and of course you can't put steroids near the eyes. No. But they do have a class of medications that are non-steroids, and you can put those around the eyes. And some children, you can see their skin is very thick and may even look a little leathery from the constant irritation and itching. So, but you can use those non-steroid creams, topical treatments on those parts near the eye. Yeah.
What are the generic for that?
Okay, you have the tacrolimus, which is the and you have pimecrolimus. So you have two of them. You have Elidel, which is the brand name, which is pimecrolimus, and then you have tacrolimus, which is the other one. Yeah.
Yeah.
And then there's the newer one. They have the newer one that works a little different. It's what's that? Chris Arbole. That's the other one, and that also attacks again the chemicals that are flaring up in the skin, that's keeping the itching and the irritation going.
Yeah, the fortunate thing is we live near the sea, so most of the eczemas that I've seen here, I mean, I've used tacrolimus when I was training in Switzerland. We had kids who had horrible eczema, but over here I've never, I mean, with good moisturizing and a little bit topical steroids, we have been able to
keep it controlled.
But yes, it's something good to keep in mind, but it's also important to highlight it's for children with very severe allergies. severe eczema where it spreads so much, and you really need to speak to your physician before you, as I said, everything's available over the counter, so it's really important that you really need to speak to your physician before using even steroids on the face, or you know, inform them. If you have a plan of action, you need to speak to your physician. So normally I do make a plan of action for my patients, what to do, but they always need to inform me when they're going up on the next level. And
yeah, because the key is you always want to you want to use the lowest strength of cream possible that will give you relief. You want to stay away from the higher potency creams as much as possible. Save that for like the really tough cases. And I just want to touch a little bit on wet wraps. That's another thing, you know, putting moisturized cloths on the child's skin will also help moisturize the skin. Then you put the moisturized cloth and then you cover it with a dry cloth. And by doing that, that also helps the skin barrier. Anything that will smooth out the skin and make it less itchy and dry will definitely help when you have eczema.
So डॉक्टर रिचर्डसन अभी बता रही थी एक दूसरी वाली ट्रिक के बारे में, इसके बारे में से पहले मैं ज़रा ट्रांसलेट कर लूँ। जो हमने पहली बात किया था वो एक दवाई के नाम है टैक्रोलामस। हम कभी कभार बहुत सीवियर एक्जिमा में इस्तेमाल करते हैं, पर्टिकुलरली जब एक्जिमा आंखों के पास आती है, ये जो खारिश, बहुत ड्राइनेस। मगर प्लीज़ ये डॉक्टर के साथ बात करें। ये आप ये जो भी दवाइयाँ हैं, मॉइस्चराइजर से ज़्यादा जो भी दवाइयाँ हैं, आप खुद ही नहीं दे सकते, आपको डॉक्टर के साथ बात करके दे सकते हैं, क्योंकि इनकी कॉन्सिक्वेंस होती है, इनकी साइड इफ़ेक्ट्स होती है, तो बहुत ख्याल से इस्तेमाल करते हैं। अभी दूसरी वाली ट्रिक जो डॉक्टर रिचर्डसन ने बताया है, जिसके बारे में उसने बताया है कि जो दवाई की ज़रूरत नहीं होती इस ट्रिक के लिए, आप गीले वाले जो तौलिया है ना, जहाँ पर बहुत ड्राइनेस हो रही है ना, उसके ऊपर गीले वाली तौलिया डाल देना और फिर उसके बाद ऊपर एक सूखी वाली तौलिया डाल देना, ताकि जो जिस्म नीचे हो जाती है ना, तो वो अच्छी तरीके से नरम हो जाती है, वो फिर उसके बाद मॉइस्चराइज करते हैं। तो ये एक दूसरी वाली ट्रिक होती है जिन बच्चों में बहुत सीवियर एक्जिमा होती है या बहुत खारिश होती है। I just hope I'm translating it with the right words, because my Urdu is also not the best.
Oh, no.
Okay. Yeah. No, so that was really, really helpful. And I think it's also important to highlight avoidance. Do not scratch. Pat, caress, rather than scratching. तो मैंने भी अभी क्या बोला है कि हाईलाइट कर रही हूँ कि आपको जो सारी एलर्जेंस है उसकी से दूर रहना चाहिए। बच्चे को स्क्रैच नहीं करना चाहिए। बच्चे को अगर खारिश हो रही है तो उसको टैप करना चाहिए, अच्छी तरीके से ऐसे ही करना चाहिए, मगर इसको ऐसे स्क्रैच नहीं करना चाहिए, वरना ज्यादा खराब हो जाएंगे।
Another thing you can point out is that even though the steroid creams can only be used twice a day, I also tell the parents, well, you can use just the moisturizing creams over the counter. That, you know, they have creams, over-the-counter creams for eczema. At another time, if you see the child scratching and it's not time to put the steroid on, that's when you can use one of the over-the-counter moisturizer, non-steroid creams to put on there just to soothe the itching. And then also putting a cool cloth over the area will also help also. If around the eyes are itching, you can put crushed ice in like a little plastic bag and just put that on the eyes, like put a wet paper towel and just set that on the eyes. And ice is a good anti-inflammatory, and it's safe. It's just water. It's safe, but it's cool, it's very calming, and it's very effective. Yes.
No, that's a really good idea. तो अभी जब डॉक्टर रिचर्डसन ने बोला है कि अगर आपके बच्चे को दवाई लिखी हुई है स्टेरॉइड की या ऐसी कुछ जिस्म पर डालने के लिए, मगर हम ये सिर्फ 2 दफा दिन में डाल सकते हैं। अगर इसमें बीच में फ्लेयर अप हो रही है, बच्चे को बहुत स्किचिंग होती है, तो आप उसके ऊपर वो जो रेगुलर क्रीम नॉर्मली आप डालते हैं ना, वो हाइपो एलर्जी क्रीम जिसमें कोई परफ्यूम नहीं होती ना, वो डाल सकते हैं इचिंग को थोड़ी सी रिजॉल्व करने के लिए। या उसके ऊपर गीला कपड़ा और फिर सूखा हुआ कपड़ा। अगर आंखों पर हो रहा है तो आप कपड़ा डाल देना did you say put a wet cloth and then ice?
Yeah, you can put a wet cloth on or wet paper towel, and then you have a little plastic bag with the crushed ice in it. You set that on there. It's very soothing to the eyes. Very soothing. Yeah.
तो उन्होंने बोला कि गीला कपड़ा डालकर और फिर एक प्लास्टिक थैली में बर्फ को तोड़कर प्लास्टिक थैली में डालकर आराम से थोड़ी देर के लिए आंखों पर डाल देते हैं। अगर बहुत सारी खारिश हो रही है और इचिंग हो रही है, ये थोड़ी सी सूदना आराम मिलते हैं इससे। Before wrapping up, I just wanted to ask about, I mean, it's important, we've highlighted in the winter months, you have your runny nose, your coughs, your colds. Again, as Dr. Richardson said, if it's not itching, it is very likely just your viral cough, because we know the cold, dry environment makes it very conducive for viruses to spread. When your child is going to school, they're picking up more and more illnesses. They can have up to 7 to 8 illnesses
in a
season, which for us adults is a lot. We'll get sick once, maybe twice in an entire season if we're unlucky. But kids can have it more frequently. It does not mean they have allergies. There is no place for antihistamines or anti-allergies for a viral cough or cold. It does nothing. Likewise, there's no place for nebulized or inhaled steroids in a viral cough and cold. I think it's just very, we discussed this a few weeks ago about asthma. I thought I'd just highlight it here again. Asthma is a reversible airway disease. You usually have to be using your Ventolin, what's the brand name Ventolin? Sorry, salbutamol albuterol, which is usually brand name Ventolin, as your reliever. If you've never ever used your Ventolin in your life and you're on inhaled steroid, that is not the normal guidelines or pathway of treating asthma. So you have to require Ventolin in order for the asthma to be diagnosed. It's a clinical diagnosis, and then you go on to the inhaled steroids if you're using a large quantity of Ventolin. And I think it's important to highlight, because a lot of, I've had recently cases come in where the children have been treated with nebulized steroids, that favorite combination of steroids and albuterol together in one ampule, for a allergic, what was considered an allergic rhinitis or an allergic, well, basically allergic rhinitis.
No, you're using a medication that's for the lungs, and that's not going to do anything for the nose, and that's what the problem is.
So that's really important that we highlight that also. I mean, we stopped everything on that child. The child was fine. So nebulizing things, I mean, we generally don't use nebulizations anymore in the outpatients. I know in the US you guys do, sometimes in individual cases for very small kids. In the UK, it's no longer, they're not allowed to prescribe it in the community at all. You have to have a subspecialist justifying why we're using the nebulizer. So, and I think in Pakistan it's important because nebulizers and things are expensive, and it's important for patients, particularly those who are on a budget, to understand that inhalers are just as good and to some degree better. You can dose them better, and they're way cheaper. And
but the key is to use a spacer, because the medicine has to get in the lungs. You must use a spacer.
As an adult, I have my spacer. If you don't have your spacer, there's no point. Okay. Now, before winding off, I just wanted to highlight, I had this case of a 2-month-old baby who had a bit of a snuffly nose, which the little ones do sometimes have, and was put in an antihistamine because it was told your child has allergies. A 2-month-old baby. So what are your comments on, you know, the under 6 months, under a year with environmental allergens? I mean, this child, I was like, we stop everything, just with saline nose spray. I was like, the child didn't even need the nose drops. He just had just this, which a lot of kids have a little bit of a snivelly nose. It wasn't even running or blocked or anything. Just making a little bit of noise, but with no discomfort at all. I was like, maybe a silent reflux, or you don't need to do anything. He's feeding comfortably. He's fine. Just stop it all. But what is your opinion on children with
runny nose?
Under 1 year?
Well, you know, under a year with runny nose, you have to look at the severity of it. I mean, if the child just has a little runny nose and you can wipe it and they're fine, they're feeding fine, you just kind of wipe their nose and that's it. I mean, if they're, what I tell parents a lot of times, if the child has a little audible breathing, you can hear a little sound like that when they're breathing. I said, but if your baby is resting comfortably, you know, some people even, you know how they bring a little video on their phone, look, look, look. I said, but yeah, but the baby is resting comfortably. It's not like the baby is tossing and turning in their sleep. The baby is lying there comfortably. So I explained to them about positional. You know, if the baby gets their head tucked down just a little bit, you know, they may make a little sound when they're breathing. If you just kind of lift their head a little bit, the sound will go away. But the key is the baby resting comfortably, is the baby feeding comfortably. If the baby is doing that, you don't need to do anything. You don't have, there's no rule that says you have to get rid of this sound. The only time you want to intervene is if it's causing the child difficulty with breathing, sleeping, or feeding. If that's not going on, you don't need to try to get rid of the noise, because all the baby has to do is kind of reposition their head and the noise goes away, so you don't need to do anything.
तो मैंने अभी का क्या पूछा था कि कभी कभार जो छोटे छोटे बच्चे, 1 साल की कम उम्र के बच्चे, 6 महीने की कम उम्र के बच्चे, कभी कभार जो 1-2 महीने के अंदर मेरे पास माँ बाप आते हैं, बोलते हैं कि हाँ नाक की थोड़ी सी आवाज़ निकल रही है, तो वो परेशान हो जाते हैं। तो डॉक्टर रिचर्डसन हम अभी बोल रहे थे, बात कर रहे थे कि इसके लिए कोई करने की जो चीज़ नहीं है, बच्ची को थोड़ी सी अच्छी तरीके से पोजीशन करना होता है, देखना होता है बच्चा कंफर्टेबल है, खुश है, सही से पी रहा है, तो कोई दवाई कुछ नहीं करना चाहिए, नाक बस थोड़ी सी साफ करना है अगर थोड़ी सी ब्लॉक्ड हो रही है, मगर इसके अलावा इसकी कोई और चीज़ नहीं करना चाहिए, क्योंकि कोई ज़रूरत ही नहीं होती अगर बच्चा खुश है और सही से पी रहा है। चंद बच्चे तो हो जाती है ये चीज़ें, इसका मतलब नहीं है कि बच्चे की एलर्जी है, और इसकी ज़रूरत नहीं है कि उनको एंटीहिस्टामिन या कोई दवाई देने के लिए। आपको ये बहुत याद रखना चाहिए कि हमारा जो कोशिश है बच्चों के डॉक्टर के की तरफ से कि जितने भी कम दवाई दे सकते हम देते हैं, क्योंकि आजकल का जो मेडिसिन होता है, एविडेंस बेस्ड मेडिसिन का मतलब है कि हम सिर्फ वो दवाई दे रहे हैं जिस पर हमने देखा ये काम करता है और ज़रूरी होता है। अगर काम नहीं करता या ज़रूरी नहीं है तो नहीं देना चाहिए। So I was just also highlighting on top of what you were saying is that as pediatricians in the world today, practicing evidence-based medicine, we want to limit the number of medications we're giving, only give them if they work and if they are needed.
Right.
Otherwise, we don't need to. And before I forget, something we spoke about, nasal decongestants, because I get a lot of kids where the parents say 3 times a day, 3 times 3, and I was like, what's that? They're like, oh, we give the nasal decongestants 3 times a day for 3 days, and then we stop, and then next time he gets it 3 times a day for 3 days, and we stop. And I'm like, it's no longer recommended in kids to give nasal decongestants if you'd like to.
The danger, the real danger with decongestants is that the more you use, the more you need, because the body will then require more and more and more. And you'll get to the point where you're just using excessive doses until the point where you'll just basically always feel congested. So because you have this rebound when you come off of it, and then you feel even more congested, so you want to use it more and more. You want to really stick with just using saline mist in the nose. I always tell people, for the infants, just put a cool mist humidifier at the bedside. Just let that cool mist drift over the child. I even try to discourage a lot of nasal suctioning. People use those little bulbs and suction the child's nose a lot. And I say, you know, you're just irritating the child's nasal area and making the congestion worse. It's just like if you keep rubbing your eye, you notice that your eyelid begins to swell. If you keep poking this thing in the child's nose, I said, you don't need to try to suction away that sound that they're making when they're breathing.
No, I just basically tell them that the nose breather, the suction is only needed if your child's, because they're predominantly nasal breathers. So like if it's really bothering them, then you clean the nose.
If it's blocked. But
otherwise, just leave it. If you just need the drops, if you just do the spray, that's fine, and they're happy with that, that's okay. If it's very blocked and they can't feed, then clean it.
Then you need to clear it.
तो हम अभी जो डॉक्टर रिचर्डसन हम जब बात कर रहे थे, वो एक दवाई होती है जो कभी कभार पहली ज़माने में हम देते थे नाक के लिए, वो कहलाती है नेज़ल स्प्रे, जो कहलाती है nasal decongestant. वो आप अपनी बोतल पर देख लेना, अगर लिखा हुआ है nasal decongestant, नाक में सिर्फ सेलाइन जाना चाहिए, उसके अलावा कुछ और नहीं चीज़ जानी चाहिए, क्योंकि ये nasal decongestant के साथ क्या होती है, नाक की आदत हो जाती है और ये कंजेस्शन होता है वो ज़्यादा ख़राब हो जाती है और बन जाती है। और जितना भी देर आप ये इस्तेमाल कर लें, जितने फ्रीक्वेंटली आप इसे इस्तेमाल करेंगे तो वो इतना ही ज़्यादा, शुरू में आराम मिलती है और फिर उसके बाद ये बहुत फिर से आ जाती है और फिर ज़्यादा आ जाती है और फिर मुश्किल हो जाती है ट्रीटमेंट करने के लिए। इसलिए बच्चों में हम कभी नहीं देते नेज़ल डिकंजेस्टेंट, सिर्फ नाक को साफ करते हैं वो सेलाइन नोज स्प्रे या ड्रॉप के साथ, और एक बल्ब होती है जो नाक को साफ करते हैं स्प्रे डालने के बाद, मगर ये आपको सिर्फ इस्तेमाल करना होता है जब नाक बंद होती है। अगर नाक बंद नहीं होती और ड्रॉप्स या स्प्रे के साथ बच्चा खुश है, तो आपको कुछ इसके अलावा कुछ देना नहीं चाहिए। Okay. I think we've touched about everything. We've gone over what an allergy is. It's basically a immune
reaction by the body, the immune system in the body to something that's attacked, and they're treating it as foreign to get out.
Yeah.
Basically what the body's saying.
Yeah, and the different treatments, which is basically same across the board. I mean, you got your environmental, your food, your contact, your medicine, allergens, which can be triggers. And basically you have your different level of allergy treatments. You got your antihistamines, you've got your steroids, and depending on the leukotriene receptor, which is your montelukast, that's your generic. And then basically avoidance is key, staying away, avoidance is key, and basically doing your ground treatment, which is usually benign treatment like with eczema, using a soap-free wash, moisturizing. There's no point in doing any steroids. It's not going to get through. And not every child needs steroids. I think that's important to highlight. Very mild cases of eczema I've seen come in because parents have never been exposed to them before. They're like, oh, my child has severe eczema. I was like, it's not severe eczema. It's very mild eczema. You need to first moisturize. First do the first line treatment properly. If you're not doing the first line treatment properly, there's no point in starting with the steroids because, as you said, it's not going to go through. And then avoiding medications that are not recommended, like your nebulizers, your inhaler,
and nasal decongestants.
Yeah, nasal decongestants. Like, for example, your nebulizer, your asthma inhalers are for asthma for your lungs. They're not doing anything up there, and no nasal decongestants. And it's important to differentiate between viral illness, which happens a lot during the winter months, and actual allergic rhinitis during the winter months. Anyway, Dr. Richardson, it was, as always, a super pleasure to have you here and speak with you. And I hope we can do this again at some point. That would be really,
find another topic.
Exactly. Yes, we'll find another topic. Parents, you guys can write in and see what you want us to talk about.
Get suggestions. That's true.
Yeah. So keep an eye on the Apple Tree Pediatrics Facebook page for the next Health Scooters series live chat. We've got another 2 physicians, development pediatrics and orthopedics lined up. But keep an eye on our Facebook page to know when we are doing that and send in your questions. I will request your questions as they come in. Is there anything you would like to say before we wrap up, Dr. Richardson?
No, I just want to just tell the parents that, they're our first line of defense because they see what's going on and that alerts them to bring the child in. And just remember, just keep everything simple, keep it basic. Don't over medicate and you'll be fine.
Yeah, I just realized that I know you so well now that I forgot to introduce you properly at the beginning of the talk because we did the talk last time and I just so Dr. Richardson is a pediatrician with 30 years experience, more than 30 years experience. I mean, mashallah, she looks very young. So do not ask a lady her age. You look very, very young. You're doing very good for someone who's being, a senior pediatrician. Very kind and has invaluable experience and training in allergies, asthma, and eczema.
Yes.
And of course, general pediatrics. But we will have further discussions on this. And thank you so very, very much.
Thank you.